All right. I always start that way, don't I? Good morning, good people. Good morning. Okay. Today is March the 9th, Wednesday morning. And I'm back on one of my favorite machines, my Roar. And iFit, who does the virtual classes, is having a challenge, which is a 50,000 meter challenge for the month. So today is my first day on the challenge. So I'm now at my cool down. I've been on the Roar for 25 minutes, and I've done 3,500 meters on my Roar. Okay, so pray for me, good people. While I'm on the Roar, as I've shared with you guys before, I'm always doing something to sharpen my saw, meaning to educate myself. I'm a lifelong learner, and I'm a nerd. I love to learn. So I've been focusing on, this morning, cardiovascular health. So that's what we're going to talk about for the next few sessions, cardiovascular health. Just little nuggets. First of all, what is your blood pressure? Do you know what your blood pressure is? Since over the past little bit more than a year, I've asked my patients to step it up and ask them to co-participate with their care. So one thing I want them to all get is a blood pressure cuff. If you do not have a blood pressure cuff, you need to obtain one. They're not expensive, 15, 30, a higher scale one might run you $50. It is worth it. So get a blood pressure cuff and document your blood pressures on an intermittent basis. There are apps online that you can document your blood pressures, and that'll be more data that you can share with your primary care doctor. And if you don't have a primary care doctor, and if you notice that your blood pressure trends on a higher side, then you need to obtain one. Lack of insurance is no excuse. There are clinics out there who will take cash. Here in Houston, you might be eligible for a gold card or government assistance with Medicaid, or if you're of age, Medicare. Your health is a priority. Health is a duty. Now, once you check your blood pressure, so how do you gauge the results? If your blood pressures range, the systolic is the top number, okay, which is, we want to be less than 120, depending on what's going on with you. But in a normal, average person, the systolic, which is the top number, you want 120 or less. The diastolic, which is the bottom number, you want 70 or less. So if your blood pressures tend to be over 120 over 70, and you've persistently checked them, I would suggest maybe the first week, that if you've never checked your own blood pressure, check it in the morning and then check it in the evening to see what they run, to see if there's a difference. Rest a little bit. Put the cuff on your arm with the little tubing part toward the inner part of your arm there. And if you can, put your arm at heart level, like rest it on a shelf or something that's heart level, or have a family member hold it so you can rest your arm in their hand at about heart level, and check it. If your blood pressures tend to be on the higher side, you need to be seen, because it's the shear force that occurs within your cardiovascular system that causes problems. We have about 60,000 miles of blood vessels. If you're pregnant, you have more. Wow, 60,000 miles of blood vessels run through our body, supplying our body with that vital fuel, the vital force, blood. All right, good people. Part 1, cardiovascular health. Get a blood pressure cuff. Check your blood pressure. In the comments, tell me what your blood pressures are. I'd love to hear. All right, Dr. Higgie signing out. Love you guys, and there's nothing you can do about it. Bye.